Child Obesity in Mississippi. Brandy, Donna, Angela, Samantha, March 16th. Community and Public Health, Instructor Brandy Merriweather. Childhood obesity is one of the major health problems affecting not only Mississippi, but also the entire United States. However, Mississippi is one of the mainly affected areas. The fact that 40% of the children in the state are obese is evidence that the situation is dire in the state. Nevertheless, Mississippi State Department of Health has established measures to ensure that the situation is managed effectively and sustainably. Child obesity in Mississippi is a prevalent problem which needs to be addressed at once because of its serious consequence on health, academics, and the economy. It is encouraging, however, to note that the state has launched policy objectives to guide schools and families in the aim to curb obesity among school-age children. Why is childhood obesity a serious concern in Mississippi? According to the Mississippi State Department of Health, obesity among children is a leading health concern. As of July 2009, Mississippi is officially the leading state in child obesity, a full 6.9% higher than the second place. The Mississippi State Department of Health also notes that 40% of children living in the state are overweight or obese. As you can see, we have a map of Mississippi with the 9 districts in it. The obesity rates by district. In the survey by the Mississippi Kids Count in 2014, the percentage of obese school-age children ages 4 to 18 are as follows. You can see that District 3 is the highest of 26.5, and District 9 is the lowest of 16.9. Interestingly, even the lowest rate is almost near the national rate of 17.3% for child obesity. Obesity by age. According to research funded by the Trust for America's Health and the Robert Wood Johnson Foundation, 13.9% of children ages 2 to 4 are obese. On the other hand, the report by the Mississippi Kids Count shows that 33% of children between the age bracket of 4 to 10 are obese, while 20% of children ages 11 to 13 are suffering from obesity. The impact of obesity. The obesity problem has severe consequences on children and the economy. According to the report compiled by the Power Initiative, a program by the Mississippi Department of Education's Office of Healthy Schools, obese children tend to miss more school days and have lower academic performance. The report also shows that 80% have the chance of being overweight and obese when they become adults. Further, they're at risk for incurring chronic disease that lead to disability or premature death, such as coronary heart disease, type 2 diabetes, heart disease, hypertension, osteoarthritis, sleep apnea, gallbladder disease, respiratory problems, stroke, endometrial cancer, breast cancer, colon cancer, prostate cancer, depression, and other conditions. On a national level, obesity among children costs Medicaid more than $3 billion every year. Policies and objectives launched by the state of Mississippi. Mississippi still lags behind the rest of the nation, but continued commitments to full implementation of coordinated school health through existing state policy can help the current generation of children grow to be fit and healthy adults. It means obesity can be solved. First, it has endeavored to build environments to promote physical activity in communities. This policy is aimed to encourage physical fitness in Mississippi. Secondly, the state aims to replace fryers with combi ovens in school kitchens. This is to promote better diet and food intake in schools. A third objective is to increase the number of school nurses in the schools so that kids' health can be monitored regularly, and in line with this, the fourth policy is to support comprehensive fitness testing in schools. The fifth policy is to improve state standards for daycare centers and youth programs to promote healthy lifestyles so that schools will make it a part of the child's daily routine. The sixth policy is also related to better food choices. Encourage recipients of benefit programs to purchase healthy foods. In order to push this agenda, the seventh policy is to control media advertisement in order to restrict advertising of unhealthy foods to children. At the same time, this policy will require public service announcements that offer healthy messages. We all know how susceptible children are to advertising that is geared toward them. If we make it toward healthy options and activities, maybe they would desire that rather than the junk that they see. The eighth policy objects to required schools to provide BMI, which is body mass index, reports to parents. This is so that parents will be well aware of their child's health conditions and properly address indicators of obesity. Ninth, the state will promote improved access to supermarkets and its products so that accessibility to better food opinions are available to all. Finally, the 10th policy objective is to require labeling of menus and prepared foods. Having mentioned the policy goals that the state of Mississippi will implement, it is evident that diminishing obesity can be accomplished if the state, schools, medical institution, and the home cooperate. But performing this will be efficient only if there is accurate monitoring of health and diagnosis or investigations of the issues. Based on the above policy goals, the state can monitor and diagnose health of children by increasing the number of school nurses, which is policy number 8, and requiring schools to provide BMI reports to parents, which is policy number 3. How about children who are not in school? The state must require all parents or guardians to submit regular BMI reports to their children to their nearest health center. The health center will be the focal point of public health monitoring so that the state will know which districts have the highest incidence of childhood obesity, investigate possible reasons, and address the cause before it is too late. Basically, at each child's checkup or at the school, if they don't have a primary health care, these numbers would be reported to the state in order to monitor the children's health as a whole. The general synopsis. Individual states retain much of the power to influence policies and regulations in the United States. Through legislative and regulatory actions, state governments are able to wield substantial power over specific actions that affect public health. Between 2003 and 2005, over 230 pieces of legislation addressing school nutrition standards and vending machines and over 190 addressing physical activities were introduced at the state level. Nationwide programs such as Let's Move and others bringing awareness to childhood obesity are a catalyst to provoke everyone to get involved in the health of our children. Taking these steps now will lead to healthier lifestyles and reduce the risk of children being predisposed to chronic illness that are associated with weight when they get older. As you can see here, there are some foods from cafeterias around the world. Having access to healthy foods and being able to eat balanced meals will alleviate some of the implications of obesity on children and the economy. Health and balanced meals not only fuel our bodies, but also help fuel our brains. With that in mind, take a look at school cafeteria food from around the globe and ask yourself, how does the United States measure up? So far, it's not looking good for the home team, but that can be changed with the correct policies to make sure nutrient-dense foods are available to all children regardless of race, sex, age, or family economic status. Also, developing policies that hold those that are in direct contact with the child accountable for their health. Fresh food is the must here. With rates of obesity and overweight reaching 50% in southern rural communities, intervening early in development may offer the best outcome because of the difficulties with changing lifestyle behaviors later in adulthood. A population-based approach is recommended over a targeted approach to cultivate a culture of healthy lifestyle behaviors when children are developing their healthcare habits. The International Obesity Task Force recommends instead that we focus on preventing unhealthy weight gain before it develops. Theorists and clinicians recommend using the social learning theory to achieve this goal because it addresses the dynamic interaction between the individual, her behavior, the environment, rather than focusing on just the individual and his or her eating behavior. Intervening early in development should yield the best results because lifestyle habits are established early in childhood. Utilizing a population-based approach appears to offer the most promise because it's economical, reaches more people, and individualized treatments programs have proven ineffective. When in the development phase of creating policies to address that the children are in and use the environment as a gateway to create partnerships with the potential stakeholders, those that have day-to-day interactions with the children. Schools are ideal environments in which to make changes that will help children from lifelong healthy habits. Getting physicians to engage parents in their child's health is pivotal to the success in the fight against childhood obesity. Physicians' public roles have been defined as advocacy for and participation in improving the aspects of communities that affect the health of individuals, and they have a primary ethical and professional responsibility for the health of community members they serve. Also, getting the parents involved and possibly enacting consequences on the parent that are not making an effort to support a healthy lifestyle for their child. An example of a policy that is already in place would be school absences and tardiness. Some school districts hold the parents liable for all missed days, and if the student gets past a certain point, the parent can be arrested. Regarding childhood obesity and healthy lifestyle, the consequences may not have to be as severe, but a policy put in place along those lines to hold the parents responsible for the food the child eats and the physical activities the child is involved in. There are leaders and/or organizations within the state of Mississippi that can assist with the policy development. The three we've selected are elected officials, policy health officials, and local health department staff. This group of people was selected because they can provide the manpower to do the research and implementation for policy development. The health department can then work with more local organizations and community members to share the policies and provide the resources to local organizations to put them into place. From here, community members and local organizations can engage parents, physicians, schools to help educate and encourage the children on a level that they can comprehend. Making healthy lifestyle changes a fun activity that gains and keeps the attention of our children is the ultimate goal. The lifestyle changes, if presented properly, will have a lasting effect on the youth, promoting healthy living into adulthood. Being able to effectively inform, educate, and empower the state of Mississippi when it comes to addressing the issues of childhood obesity will start from a government level. This will start from mobilizing community partners. State and local officials have the resources to be able to gather teams to address issues in the community. Starting with a diverse panel to do the research and create a partnership with the stakeholders will lead to creating lasting partnership in the community. Once these partnerships have been created, then they will be able to properly inform, educate, and empower the community. The information being given to the public needs to be accurate and not cause a panic among the people. It's not wise to use scare tactics, but presenting the facts to educate the public on childhood obesity, what it does to children's bodies and minds, how it affects their future, and ultimately, the future of the nation will empower the people to make better health choices. Additionally, once the research surrounding the childhood obesity has been compiled, state and local officials can then begin to develop and implement policies that will promote healthier lifestyle in the early years of a child's development.